The harsh glare of the fluorescent lights in Metropolitan General's conference room painted sharp shadows across my parents' faces as they studied my proposal. My father's reading glasses balanced on the bridge of his nose while he methodically turned each page, and my mother's flawless nails tapped impatiently against the polished mahogany surface. Dr. Elizabeth Carter, my father read aloud, his voice thick with disdain, requesting to buy into Carter family practice. He lifted his eyes to exchange a knowing look with my mother. Interesting timing, considering your current role. I said nothing, watching them dismiss 3 years of careful preparation with each patronizing flick of the page. To them, I remained the disappointment, the daughter who had chosen the emergency room over their prestigious private practice, the one working nights among ordinary patients while they catered to Manhattan's elite. Elizabeth, really? My mother sighed, pushing the papers away. A resident salary? You truly believe you can afford this? I've been careful with my savings, I replied evenly. And my experience in emergency medicine has prepared me well. Experience? My father scoffed. Running around the ER like a common physician. Our patients expect sophistication, refinement. They want the Carter name to carry weight. They had no idea how powerful the Carter name would be after tomorrow. I've built a strong patient base, I said. My department consistently ranks highest in patient satisfaction. My mother adjusted her Hermes scarf, her tone cutting. Where you treat anyone who walks in, she said, as if I had insulted our family's legacy. My phone buzzed softly with another lawyer's update about tomorrow's announcement. I ignored it, focused on the conversation I knew would end exactly as I intended. You can't buy into the practice, Dad said finally, snapping the folder shut. Not now, not with your current credentials. Maybe in a few years, if you rethink your career path. You mean if I give up emergency medicine? I asked softly. Real medicine, he corrected. Private practice. Elizabeth. Selective clientele. Building relationships with the right people. I thought of the contract waiting in my private office upstairs, the one they had no idea existed. Tomorrow's board meeting would be about building relationships, but not the way they imagined. We're doing you a favor, Mom added, her tone dripping with false concern. The buy-in would ruin you financially, and our patients expect a certain level of decorum. Your ER stories of shootings and overdoses won't impress Mrs. Astor during her Botox appointment. My phone buzzed again. I glanced at it, confirmation from the hospital board secretary, 9 a.m. tomorrow. I understand, I said, collecting my proposal. Thank you for your time. That's all. Dad blinked, taken aback by my silence. No arguments. No pleading. No, I said, a small smile forming. I think tomorrow will create enough change on its own. Finally recognizing your limits? Mom asked, satisfied with what she assumed was my submission. Something like that. I straightened my white coat. I should get back to my shift. The emergency room won't run itself. As I reached the door, Dad called after me. Elizabeth, we expect you at the board meeting tomorrow. As a Carter, you should at least be present when our privileges are renewed. Oh, I'll be there, I assured him. Thinking of the sealed envelope waiting in my office upstairs, I knew there was no way I'd miss this moment. The Metropolitan General Hospital boardroom buzzed with quiet chatter as board members and department heads trickled in for the 9 a.m. meeting. My parents claimed their usual front row seats, crisp white coats immaculate, name tags catching the light. I slipped into a chair at the back, observing them mingle with the familiar faces, plastic surgeons, private practice owners, doctors who treated medicine more as a business than a vocation. This meeting of the Metropolitan General Hospital Board is now called to order, announced Dr. Williams, the elderly board chairman. Before we proceed with our agenda, we have a very special announcement. My parents straightened instantly, expecting the routine renewal of their privileges to be approved without question. As you know, Metropolitan General has recently been acquired by Summit Healthcare Group, Dr. Williams continued. Today, we are proud to introduce our new Chief of Medicine, who will also serve as CEO of Summit's East Coast operations. Whispers ran through the room, news to everyone but me. Dr. Elizabeth Carter, please step forward. The sudden hush was deafening. My heels clicked on the polished floor as I approached the podium, savoring the way my parents' faces paled. Elizabeth, my father stammered, voice trembling. There must be some mistake. No mistake, Dr. Carter, I said, composed and formal. 3 months ago, Summit Healthcare acquired Metropolitan General through a series of private equity transactions, deals I orchestrated. Impossible, my mother breathed. You're just a resident. A resident who spent the last 3 years running a healthcare investment firm while working in the emergency department, I clarified, opening my laptop. Summit Healthcare is my company. I hold 67% of Metropolitan General and 5 other hospitals along the East Coast. The screen behind me lit up with financial reports, acquisition records, and my official appointment as Chief of Medicine. My parents' eyes widened at the figures, billions in assets, thousands of employees, and their daughter's name at the top. Now, I continued, let's discuss some immediate changes. First, the hospital's mission: we are expanding emergency services, doubling trauma center capacity, and launching a new community health initiative. But our practice, my father stuttered. Our privileges. I pulled up another document. As Chief of Medicine, I am reviewing all private practice privileges. Those who don't meet the new standards, including minimum emergency room hours and community service, will have their privileges revoked. You can't do this, my mother exclaimed, standing. We built our reputation here by catering to wealthy patients over critical care, I said calmly. That ends today. Metropolitan General will serve everyone, not just those who can afford boutique medical services. The board won't allow this, my father declared, searching for allies. But the other members remained silent, some nodding in agreement. The board has already voted, I said, showing the results. Unanimously, your privileges are suspended pending review. You have until month's end to meet the new requirements, or find another hospital. Were you our daughter? My mother hissed. Yes, I said, smiling. And you taught me well, about business, medicine, and power. I just chose to use those lessons differently than you expected. 1 month later, I walked through Metropolitan General's renovated emergency department, ready to see the results of my plan in motion. Observing the organized chaos of a level 1 trauma center in full swing, I noted that the expansion was nearly finished, twice the beds, cutting-edge equipment, and a staff finally empowered with the resources they deserved. Dr. Carter, my assistant, appeared at my side. Your parents are here for their meeting. I glanced at the clock. Send them to my office in 5 minutes. I need to wrap something up first. I made my way to Trauma Bay 1, where a young resident was treating a homeless man with infected wounds, the same patient my parents would have turned away just a month ago. Good work, Dr. Chin, I said, scanning her treatment notes. Make sure he's connected to our new outreach program before discharge. Yes, Chief, she replied, smiling. Clearly still astonished that the Chief of Medicine actually pulled shifts in the ER. Back in my office, once my father's, I waited as my parents were ushered in. They looked different now, humbled, worn, maybe even a little apprehensive. Elizabeth, my father began, we've reviewed your requirements. I gestured professionally for them to take a seat. The ER shifts, my mother said softly. We've started them, along with the community clinic hours. I opened their files on my tablet. I see. 3 nights in the ER, 2 afternoons at the clinic. That's a beginning. It's eye-opening, my father admitted. Last night we had a multi-trauma case. Gang-related shooting. I haven't faced anything like that in years. Welcome to real medicine, I said, thinking of all the times they had dismissed my ER stories, where patients aren't chosen based on wealth. We've been reconsidering, my mother leaned forward. About your original proposal to join the family practice. Have you? I raised an eyebrow. And we were wrong, my father said simply. About you, about emergency medicine, about everything. What you're accomplishing here, It matters. All medical work matters, Dad, I replied. That's what I tried to explain for years. I walked to the window overlooking the emergency entrance. But this isn't about joining your practice anymore. What do you mean? The Carter family practice will become part of Metropolitan General's new community health initiative. I turned back to them. You can remain as attending physicians, working alongside the colleagues you once dismissed. Same pay, same rules, same dedication to treating every patient who needs help. They exchanged glances, decades of privilege confronting reality. And if we refuse? My mother asked softly. Then you'll need to find another hospital. Summit Healthcare owns most of the private facilities in the region now. My father nodded slowly. You planned this, all of it. The ER work, the investment firm, the acquisition. I learned from the best, I said, smiling faintly. You taught me about power and prestige. I chose to use that knowledge to change the system instead of profit from it. My phone buzzed, a trauma alert. Multiple casualties were en route. I need to get back to the ER, I said, grabbing my white coat. The paperwork is on my desk if you choose to stay. Either way, Metropolitan General will continue to care for everyone who needs it. That's non-negotiable. At the door, I paused. And if you do stay, those ER shifts aren't temporary. Every doctor here works them, especially the chief of medicine. As I headed to the trauma bay, I heard my father's voice behind me. We'll sign. I smiled as sirens grew louder. They had finally learned what I had always known: true medical excellence isn't measured by the wealth of your patients, but by the lives you save, no matter who they are.